about cardiovascular diseases or heart diseases for that matter. We've talked about some cancers. We've talked about other non-communicable diseases, diabetes, hypertension, and all that. Tell us about the relation between these sugar-sweetened beverages and these disease conditions.
Diseases. Yeah. So thank you very much. So it starts with overweight and obesity. The more sugar you consume, and most of this excess sugar is not needed in the body, so the body stores it. One of the ways the body stores it for the long time is to convert the sugar into fat and store, so you will gain weight. Now, overweight and obesity are risk factors for more than 13 different cancers and all the cardiovascular diseases. So we must fight overweight and obesity. That's number one. Now, number two, diabetes, as an example. So even if you are not overweight and obese, but you are consuming a lot of these simple sugars from the sugar-sweetened beverages, the sugar enters and the body doesn't have to digest it, so it gets into the blood and increases your blood your blood sugar. So when you go to you start to have some symptoms, and then they test and they say you have diabetes. It doesn't end there. If it's not controlled, the diabetes would even lead to more complications, because the sugar levels in the blood, once it's in the blood, it hasn't gotten into the body where it will be used. It is roaming. It gets into the eyes. It will cause cataracts or diabetic retinopathy. If it gets into the kidneys, it's going to get nephropathy, or the kidneys are going to fail. If it gets into the nerves, neuropathy, your nervous system, and what makes your system to work and your brains to work will all be problematic. If the sugar in the blood also can block the vessels. The vessels are the components that let things go move in your blood. So it goes from to the different organs that they are needed. Once the vessels block or become narrow, the blood pressure will rise, because the blood is now pushed with a pressure to get it to go through the small narrow veins and the arteries. What that means is that you're going to develop high blood pressure. High blood pressure is now the commonest outpatient disease that is reported in the hospitals among
the one they call the silent killer.
Hypertension. And you walk with it can lead to stroke, because it can go into the brains and burst, and then lead to stroke. It can lead to heart failure, and it can lead to so many other things.
All because of sugar consumption.